Marcus sprinted through the marble lobby of Metropolitan Hospital, deftly dodging two security guards as he slipped past the bustling crowd. Reception desk and burst through the ICU doors where a dedicated medical team had just declared 16-year-old Sophia's. "This case is hopeless. Stop the treatment, you're killing her," the barefoot 12-year-old shouted, snatching the patient chart from Dr. Elizabeth Whitmore's hands conveyed urgency as she stated, "This isn't brain death, it's locked-in syndrome, and you've been medicating her." For 2 weeks, the Harvard-educated neurologist chuckled, until Marcus pointed out the error. To 3 symptoms that every specialist had overlooked, symptoms he had committed to memory from a tattered medical textbook he had been carrying. Since his sister passed away due to the very same misdiagnosis 3 years prior, what unfolded next not only preserved Sophia's life shattered the arrogance of an entire medical system, demonstrating that knowledge does not necessitate a degree, it simply exists. The bravery to confront what others choose to ignore. Marcus had gone without food for 2 days when he made that frantic dash through the hospital, yet he bore something far more precious than any medical diploma, the truth that eluded everyone else. Too proud to acknowledge the truth, this is the tale of a homeless boy, his fingernails caked with dirt, who unraveled the mystery of what lay before him. Million-dollar doctors failed, and how this will forever alter your perception of expertise beneath the fluorescent lights of Room 314 in the neurological wing of Metropolitan Hospital buzzed with the clinical precision of contemporary healthcare. The million-dollar equipment had transformed into monuments of failure. Dr. Elizabeth Whitmore, the hospital's chief neurologist, and a woman whose personal wealth rivaled that of small nations, stood before a wall of monitors revealed the same harrowing truth they had displayed for 14 unbroken days. Sophia Chen, 16 years old. The old man was fading, and the reason eluded everyone. The brain scan showed no signs of change, leaving the doctor perplexed. Whitmore addressed the gathered team of specialists, her voice resonating with the kind of authority that only a Harvard education could bestow. 3 decades of medical practice and a personal fortune amassed through the art of healing. Consulting reveals a complete lack of responsiveness to all stimuli, with no eye movement and no voluntary actions observed. Control of muscles shows no signs of advanced cognitive activity from the international team she had personally recruited and funded. Nodding in solemn agreement, Dr. Hans, the legendary Dr. Miller from Munich, renowned for his expertise in neurological trauma. Sarah Kim from Johns Hopkins, who authored the textbook on comorbid states, Dr. Antoine Dubois from the Seine, transported at Whitmore's expense due to his groundbreaking research on consciousness that transformed European medicine. Collectively, they accounted for more than $2 million in consultation fees accrued over decades. The fusion of extensive experience and the utmost peak of medical education. They had utterly failed. The family was becoming increasingly challenging. Dr. Whitmore continued, casting a fleeting look toward the hallway where Sophia's parents held their steadfast watch, inquiring about alternatives. "We must ready them for treatments, second opinions, and experimental procedures." The unavoidable discussion surrounding life support loomed outside room 314, where Maria Chen lay. She pressed her ear to the crack in the door, her heart shattering with each clinical word. For 2 weeks, she'd watched her. The daughter, once vibrant and laughing, now lies motionless in a bed, preparing for her junior year of high school, surrounded by machines emitted a symphony of beeps, each note resonating with mechanical indifference. The doctors conversed in a language that eluded Maria, their words swirling around her like a fog she couldn't penetrate. Their expressions conveyed the narrative with striking clarity. They were surrendering. It was then that she noticed him, a boy, perhaps 12 years of age. Barefoot and soiled, he stood at the far end of the corridor, his oversized clothes held together with safety pins and his hair was unkempt, his face marked with the sort of dirt that spoke of nights spent under the open sky, yet his eyes were deep and dark, intense and oddly focused. Her gaze was fixed on room 314, bearing an expression that Maria had never witnessed on the faces of any costly physicians. A sense of certainty enveloped the boy as he approached slowly, clutching something tightly. Pressed against his chest as he approached, Maria could discern that it was a medical book. A battered textbook, frayed and tattered, bound by duct tape and adorned with scrawled annotations. "Excuse me," he said. Softly, his voice carried a maturity that belied his appearance. "Is that your daughter in there?" Maria, startled, I blinked. "Yes, how did you?" "I can help her." The words lingered in the air. A challenge to all that Maria had been led to believe over the last fortnight, this child, this homeless boy without shoes, and a textbook that appeared as though it had been salvaged from a dumpster was asserting that he could accomplish what teams of world-renowned specialists couldn't. "What did you say?" Maria whispered, the boy's voice trailing off. His grip tightened on the book. "Your daughter," he said, "the doctors think she's brain dead, but she's not. They're treating the wrong condition. Every day, the situation worsens, and before Maria could utter a word, the voice of Dr. Whitmore cut through the tension. She sliced through the hallway with precision, her voice steady as she called out, "Security, there's an unauthorized individual in the ICU." Two guards appeared almost instantly, their hands already reaching for the boy's thin shoulders, but Maria Chen, propelled by a mother's desperation and the first flicker of hope she had experienced in 14 days, interposed itself between them. "Wait," she said with unwavering resolve. I want to hear what he has to say." Marcus Williams had been 12 years old for precisely 4 months when he discovered that hunger paled in comparison to the profound helplessness that enveloped him. For 3 long years, he had navigated the unforgiving streets of Chicago, enduring a relentless struggle for survival. Since that fateful night when everything shifted, he realized that both the cold could be borne and the hunger could be. To witness the slow demise of another, knowing full well the means to rescue them, was a torment that lingered endlessly within the confines of his makeshift shelter. Underneath the Roosevelt Bridge lay a meticulously crafted stronghold, built from cardboard, tarps, and an array of salvaged materials. Yet, the true treasure lay not in the shield against the elements, but in the trove of medical textbooks he had amassed. Salvaged from the refuse behind the university, volumes discarded by former students upon their graduation. That had become Marcus' entire world. Gray's Anatomy, 41st edition, Harrison's Principles of Internal Medicine, Robbins and Cotran Pathologic Basis of Disease. Every book bore the scars of its past, with missing pages, coffee stains, and the remnants of highlighting left by previous readers. Yet to Marcus, they were flawless. He had devoured each volume from cover to cover on numerous occasions, inscribing the margins with his own thoughts. Observations and cross-references revealed that the other homeless individuals in the area referred to him as Little Doc, and they had come to understand. To rely on his counsel when pneumonia loomed over the camps during the harsh winters of Chicago, Marcus was able to discern, identifying symptoms promptly and guiding individuals to appropriate clinics when complications from diabetes emerged in the elderly. The residents he was familiar with understood which emergency rooms would accept them, bolstered by his reputation, had woven its way through the hidden channels of the forsaken, drawing seekers to him. Yet it was Marcus's wisdom. It stemmed from more than mere textbooks, it emerged from a tragedy. 3 years prior, he had a sister, Lily Williams, aged 14, who was the brightest among them. The individual he had ever encountered had been expressing her struggles with headaches, a lack of focus, and sporadic instances where she appeared to drift away entirely. Their foster parents had brushed it off as mere teenage drama, while the school nurse had implied that she craved attention. Even the emergency room doctor, during their solitary visit, had identified stress and subsequently sent her away. Her home, accompanied by directives to prioritize rest. Marcus had sensed that something was amiss. He had observed the way Lily's eyes, at times, a subtle movement stirred beneath her closed eyelids during her episodes, mirroring the way her fingers twitched in intricate patterns that felt almost too. He aimed to be random, yet he had tried to convey this to the adults. But who truly listens to a 9-year-old boy from the foster system? On the night Lily succumbed, officially classified by the coroner as sudden unexplained death syndrome, Marcus had stealthily entered. In the quietude of the hospital's medical library, he found himself immersed for hours, delving into the complexities of locked-in syndrome and the nuances of partial consciousness. Contemplating the myriad ways in which the brain could sustain injury, often without any visible external indicators, he had come to understand that Lily, she had not been unconscious during those episodes. Rather, she found herself ensnared within her own body, fully aware yet powerless to express herself. Perhaps she was filled with dread, knowing that the diagnosis capable of saving her life lay hidden within those textbooks. The treatment, after all, was straightforward, established effective, yet no one had considered the insights, for the observations of a 9-year-old were dismissed without a second thought. That night, Marcus resolved to make 2 pivotal decisions. First, he vowed never to reside again in a system that had so profoundly failed his sister. Entirely in the moment, he would absorb all the knowledge those textbooks held. What transpired with Lily would not befall another soul, not if he had any say in the matter. As he stood in the sterile hallway at Metropolitan Hospital, Marcus identified the symptoms he had committed to memory during those late nights spent reading. Sophia Chen, with her flashlight in hand, wasn't brain dead. She wasn't in a coma. No, she was locked away within her own being, likely gripped by fear, likely conscious of every dialogue the doctors were on the verge of giving up on her. The medical team's error was not merely a mistake, it was a daily threat to her life. Persisted with their existing treatment regimen, inadvertently driving her further into neurological decline. Yet Marcus, he knew the pathway back. He had studied it every night for 3 years, waiting for the chance to save the sister he had lost. Dr. Elizabeth Whitmore had established her reputation through meticulous control and an unwavering confidence that stemmed from an elite education and boundless resources. As she glided down the hallway, she moved toward the disturbance outside room 314, her custom Italian heels clicking against the polished marble floor. Experienced the well-known wave of annoyance that followed any threat to her command. "Chen," she uttered, her voice adopting the specific tone she reserved for challenging family members, "I comprehend that you're experiencing an exceptionally challenging situation, yet permitting unauthorized individuals into our ICU is." Maria Chen stood her ground, firmly opposing both the hospital policy and the potential dangers it posed for her daughter. With a protective arm still extended between the security guards and the boy, Dr. Whitmore listened intently as the child asserted his understanding of the situation. "Something is amiss with Sophia," he asserts. "You're addressing the incorrect ailment." Dr. Whitmore's laughter was piercing, almost surgical. "Mrs. Chen, I understand that desperation can render even the most ludicrous possibilities plausible, yet this child," she gestured dismissively toward Marcus, "who possesses neither medical training nor credentials. A potential avenue for comprehending your daughter's condition lies in the expertise of my team, which boasts over 60 years of collective experience in neurology. We have sought the expertise of the most esteemed medical professionals across 3 nations, conducting every conceivable test known to contemporary science." Marcus stepped forward, his torn textbook clutched tightly against his chest. "Ran the incorrect tests." The statement lingered in the air, a palpable blow. Dr. Whitmore's gaze sharpened as she scrutinized the audacious child who had the audacity to challenge not only her authority but the very principles upon which everything was built. "In the realm of medical hierarchy, I must interject, locked-in syndrome manifests in various ways." "Adolescence," Marcus said, his voice steady despite the tremor in his hands. "The development of neural pathways is an ongoing process, which means that the traditional eye movement responses may not manifest right away. You have been evaluating consciousness through adult metrics, yet Sophia's mind is resisting the condition in ways that your protocols failed to encompass." The sensation Dr. Whitmore encountered an unfamiliar feeling that had eluded her for decades. It was uncertainty, not born from the usual sources. Had faith in this homeless child, for his words possessed a precision that seemed improbable in such circumstances. "How exactly did you come by this information?" Marcus opened his battered textbook to a page adorned with his own handwritten notes. In her 2019 research, Dr. Elena Vasquez meticulously documented 17 cases of atypical locked-in syndrome in patients aged 14 to 17. Presents diagnostic markers that are entirely distinct from adult presentations, yet the majority of neurologists remain unaware of her contributions, as they were published in the secondary journal. Dr. Whitmore's confidence wavered. She was aware of Vasquez's research. It had been contentious and predominantly overlooked by the conventional medical establishment, and indeed it had found its way into a journal she seldom perused. "Dr. Whitmore, the esteemed physician," Miller interrupted, approaching with the latest test results. "The EEG patterns are. We are observing anomalies previously unencountered. Theta wave fluctuations emerge that defy our existing diagnostic framework." "What kind of fluctuations?" Marcus inquired, just as Dr. Whitmore was about to respond. Mueller blinked, seemingly realizing the boy's presence for the first time. "I'm sorry, who?" "Reveal the patterns that Marcus pressed, particularly when theta waves are present in the 4 to 7 Hz range, interspersed with occasional gamma spikes. Above 30 Hz, that is not brain death, rather, it is a conscious mind striving to transcend neurological barriers." Dr. Whitmore seized the EEG printout from Dr. Muller's grasp, her eyes darting over the data. The patterns aligned perfectly with what the boy had described. "This as impossible," she whispered. "No," Marcus replied quietly. "It's simply uncommon, and if you continue to address her condition as brain death rather than locked-in syndrome, those patterns will inevitably emerge. The medication you are administering is entirely suppressing the very neural activity she requires to thrive." For the first time in her 30-year career, Dr. Elizabeth Whitmore found herself confronting a possibility that questioned all her convictions regarding medicine, as this unkempt child from the streets could possess knowledge she lacked, and if he were correct, her entire team had been gradually endangering their patient for 2 weeks. The ICU lay in hushed stillness, broken only by the rhythmic sigh of ventilators and the gentle beeping of heart monitors. Dr. Whitmore gazed intently at the EEG readout in her hands, her thoughts swirling with urgency. Through the implications of what Marcus had just revealed, the assembled specialists of the medical team stood in a hushed reverence. Having flown in from across the globe at her own expense, they awaited her response. "This is absurd," Dr. Whitmore declared. At last, she spoke, yet her tone was devoid of its customary assurance. "You're asking me to entirely re-evaluate a diagnosis based on the insights of a young observer, lacking formal medical training or credentials." Without any formal training, Marcus stepped closer, his bare feet making no sound. Against the chill of the floor, I urge you to reflect on the notion that perhaps credentials are not the sole means to grasp the essence of medicine. Perhaps, at times, the solution lies in being observant rather than merely adhering to established protocols. Dr. Whitmore snapped, her authority reasserting itself. "This distinction is what separates genuine medicine from mere guesswork. It is what shields patients from what." Marcus interrupted, his youthful voice tinged with a sharpness of pain that pierced through her. "The professional demeanor exhibited by individuals such as myself, stemming from a genuine attentiveness to the patient's intentions." Maria Chen observed the exchange, her heart swelling with a mix of hope and dread. The boy stood defiantly against one of the city's most formidable doctors, and she could sense the simmering anger within Dr. Whitmore. Yet, she perceived another layer beneath the surface. Doubt lingered as Dr. Whitmore and Dr. Kim exchanged words. "With a hint of reluctance, we might want to at least contemplate the implications of abandoning 30 years of medical practice unfolded as a homeless child, with a tattered textbook in hand," absorbed the words. Dr. Whitmore's voice rose, echoing through the air, reverberating against the clinical confines. "This is precisely the sort of perilous mindset that leads to patient fatalities." Marcus's hold clutched his book, the perilous thoughts echoing the past events that befell my sister. The words tumbled like heavy stones into still water, creating ripples of silence that spread through the gathered medical professionals. Dr. Whitmore's presence loomed large. Her expression shifted, some of her anger replaced by curiosity as she regarded "Your sister Lily Williams, just 14 years old, passed away 3 years ago from what the coroner described as sudden, unexplained death syndrome." Marcus' voice was steady, but his eyes held the burden of unhealed grief weighed heavily upon her, mirroring the symptoms that Sophia had experienced, reflected in the same EEG readings. Patterns reflect the same theta-wave fluctuations, and the doctors engaged in similar actions as you are now. They followed suit. Protocols aside, Dr. Whitmore sensed a chill settling in her stomach. "What are you suggesting?" she asked, her voice laced with unease. "Proposing that perhaps if a single doctor had spent just 5 minutes contemplating the complexities of a 14-year-old girl's mind, unlike an adult, my sister would still be alive." Marcus gazed intently at Dr. Whitmore, his youthful face reflecting a mix of hope and despair. Bearing the burden of countless years dedicated to examining every nuance of his sister's case, "I propose that if you please do not discontinue the current medication protocol and begin treatment for Sophia's locked-in syndrome, it could have dire consequences. Her the same way they killed Lily." The accusation hung in the air, a palpable presence that Dr. Whitmore felt deeply. With the eyes of her entire team upon her, she felt the immense weight of her reputation, her career, and her self-image as a healer, all precariously balanced on a knife's edge. "You expect me to gamble with my patient's life based on the medical opinion of a 12-year-old homeless boy?" "No, Marcus," he said softly, "I'm asking you to set aside your pride to save her life." "Dr. Whitmore." She fixed her gaze on him for a prolonged moment, then shifted her attention to the EEG readout in her grasp, and finally turned her eyes toward room 314, where Sophia Chen lay connected to machines that could be gradually taking her life. "If I grant you 5 minutes to assess her," she spoke deliberately, "and if the assessment proves to be incorrect, I will have you arrested for interfering with medical treatment." Marcus nodded. Without a moment's pause, I sensed that Dr. Whitmore's jaw clenched tightly. "You're correct. Everything I've held to be true about medicine for the past 30 years must now be re-evaluated. Let's address the news." Flowing through the corridors of metropolitan hospitals, a current of energy surged, as nurses momentarily halted their rounds, maintaining an air of orderliness, murmured in supply closets while residents huddled in small groups, all engaged in fervent discussions about the unimaginable scene. In the neurological wing, a homeless child was on the verge of examining a patient who had received the most expensive medical care. The team in the city had lost hope for Nurse Patricia Rodriguez, who had devoted 15 years to the ICU. As she stood outside room 314, with her arms crossed, she observed Dr. Whitmore guiding the boy toward Sophia's bedside. "This is the most ridiculous. It's the most astonishing thing I've ever witnessed," she murmured to her colleague. "That child likely doesn't even know what a stethoscope is." 4. Yet, as she articulated her thoughts, Patricia couldn't shake off a persistent worry that had been haunting her for days throughout her nights. In the stillness of the room, after the family had departed to find solace in sleep, she observed subtle shifts, tiny movements emanating from Sophia. There was nothing dramatic, nothing that would register on the monitors, just subtle shifts, a slight alteration in the rhythm of breathing when voices echoed in the hallway, a subtle change in expression flickering across faces as specific melodies drifted from the radio. She had brought it up to Dr. Whitmore once, but the doctor had brushed it off as mere wishful thinking, a product of post-coma reflexes. She had referred to them as meaningless neural static, yet now she observed Marcus approaching Sophia's bed with a reverence that was unparalleled. Among the million-dollar specialists, Patricia found herself pondering whether those movements had been devoid of significance. In the family waiting area, whispers began to circulate among the gathered families, each one keeping a watchful eye. Tom Bradley, whose wife was recovering from brain surgery 2 rooms down, he shook his head in disbelief. They were allowing a street kid to examine patients. What comes next? Perhaps envisioning janitors undertaking surgery, yet it is Maria Chen's sister who has arrived from Phoenix that morning, her gaze fixed on the scene outside the window, a spark of curiosity igniting within her. "Look at him," she whispered to Maria observed. "Look at how he's moving around her bed. He's not merely focused on the machines, but on her." It was, indeed, Dr. Whitmore and her team dedicated 2 weeks to concentrating on the monitors. As Marcus pored over the readouts and test results, his focus shifted to Sophia herself. He moved with deliberate slowness. Circling the bed, he scrutinized her from various perspectives, his gaze capturing minute details that eluded the sterile observations of a clinical eye. In the hushed corridors of the hospital's administrative offices, whispers of an unusual situation had found their way to Dr. James Morrison. Metropolitan's chief of staff stood at his window, gazing out over the ICU wing, phone in hand, caught in a moment of contemplation. "We need to call security to put an end to this medical circus before it tarnishes the hospital's reputation," his assistant urged. With a hint of reluctance, Dr. Whitmore's team signifies a considerable financial commitment if this child somehow casts doubt on their efforts. Dr. Morrison nodded solemnly at the metropolitan hospitals. Their reputation was forged through the ability to draw on the finest medical intellects, for which they commanded a premium. Exceptional rates due to their outstanding outcomes, a homeless child thriving in a realm where global standards are set. The failure of specialists would provoke unsettling inquiries regarding the worth of costly medical treatment, yet even as he contemplated concluding the examination, Dr. Morrison felt a surge of curiosity at the age of 30. Years spent in hospital administration had exposed him to medical miracles, yet he had also witnessed the pitfalls of medical arrogance, at times, the most. The costly diagnosis proved to be inaccurate. In room 314, the atmosphere was thick with tension. With a palpable sense of urgency, Marcus knelt beside Sophia's bed, his torn textbook splayed open to a specific page. With his handwritten notes in hand, he started to speak in a hushed tone, not addressing the gathered doctors, but rather directing his words solely to Sophia. "Greetings, Sophia. I am Marcus. I am aware that you can hear me, even if others doubt it. I understand that you are confined within, and I understand that fear grips you, but I want you to know that there is someone who truly comprehends the turmoil you are experiencing." Dr. Whitmore began to interject while conversing with patients, an act deemed therapeutic yet ultimately devoid of significance, yet still something. As Sophia's heart rate monitor indicated a subtle uptick in rhythm, Marcus pressed on. "I'm going to ask you to, if you can hear me and grasp my words, I would like you to attempt a simple action: blink twice. Please do not hesitate. Do not fret if it doesn't unfold flawlessly, your mind is navigating through considerable interference at this moment." The atmosphere has shifted. 14 pairs of medical professional eyes remained fixed on Sophia's closed eyelids, enveloped in a profound silence. Then, with a slow and deliberate grace, Sophia Chen blinked twice, each blink a measured pause in the rhythm of her thoughts. Sent shock waves through room 314, as Drive Whitmore stumbled backward, her face drained of color. As Dr. Muller seized the nearest chair for support, the monitors displayed unmistakable spikes in Sophia's heart rate and blood pressure responses that seemed implausible in a brain-dead patient that was. "Voluntary movement, doctor," Kim whispered, her voice barely rising above the mechanical hum of the life support equipment. Marcus remained calm, his hand gently resting on Sophia's arm. "Sophia, you're doing wonderfully. Could you give my hand a gentle squeeze?" A mere touch of pressure. The faintest squeeze arrived, so subtle that only Marcus perceived it, yet it was sufficient. "She's conscious," he declared, simply turning to face the astonished medical team. "She's been aware this whole time, imprisoned within a body that ceased to engage in a typical manner during every discussion surrounding the cessation of life support. every choice you've undertaken. Devoid of her perspective, she had absorbed every word. Maria Chan sank into a chair. Tears streamed down her face. For 2 weeks, she had shared everything with her daughter, school, friends, the weather. Her fears about losing her, never realizing that Sophia had heard every word, echoed in the silence of the room. Whitmore discovered her voice, though it emerged as little more than a whisper. "How did you know? How could you possibly have? Have we pinpointed what we overlooked?" Marcus's expression became remote, and for an instant, the professional demeanor he had maintained cracks that unveiled the grief-stricken 12-year-old beneath. As I witnessed my sister succumb to the... He opened his well-worn textbook to a page near the back, where a photograph was affixed to the margin. The image captured a young girl, her eyes and smile reminiscent of Marcus, with her arm draped around a smaller boy who was undeniably Marcus himself. At the age of 9, Lily Williams began experiencing episodes, which intensified when she turned 13, where she would suddenly freeze, her gaze becoming vacant, her form growing slack. Yet, there was an unusual quality to her state during those episodes. It felt distinct from mere unconsciousness, as I observed her eyes shifting subtly. In patterns, as if attempting to convey a message, Marcus' voice became more resolute, drawing him deeper into the recesses of his memories. He had revisited it countless times. The doctors had claimed it was stress, perhaps a form of teenage hysteria. Yet, even when the episodes extended in duration, even as she ceased to acknowledge her name, they insisted it was psychological. What a perplexing notion! What transpired with her? Dr. Whitmore inquired, although her medical instincts had already begun to sense the unfolding situation. Proposed the dreadful response. She endured an episode that spanned 3 days, according to the doctors. She stated that she was catatonic, experiencing a severe psychological break. They administered sedatives to soothe her system. Marcus's. His hands quivered ever so slightly as he turned the page in his textbook, unveiling sheets filled with meticulous notes penned in a child's handwriting. Inscribing those sedatives dulled the precise neural pathways she required to. Instead of aiding her in breaking free from the confines of her locked-in state, they inadvertently propelled her further into a profound neurological shutdown. The room was enveloped in silence, save for the gentle beeping of Sophia's monitors, which now displayed intricate patterns. In the wake of Lily's passing, I took from the depths of awareness rather than succumbing to the flat lines of brain death. I delved into every medical textbook I could find, absorbing all there was to learn about consciousness, comas, and locked-in syndrome. Discovered that the doctors had been mistaken about everything. Marcus gazed up at Dr. Whitmore, his eyes reflecting a depth of emotion that was overwhelming. He possessed an impressive depth of knowledge for someone so young. Lily was neither mentally ill nor catatonic. She experienced a classic case of locked-in syndrome, likely triggered by a viral infection that induced inflammation within her brain. The stem and the treatment, Dr. Whitmore inquired, though she suspected she already had the answer. An uncomplicated anti-inflammatory treatment aimed at alleviating the swelling in the brainstem, when used in conjunction. Through targeted neural stimulation exercises designed to restore communication pathways, the success rate exceeds 90% if caught early. Marcus' voice bore the heavy burden of 3 years spent in pursuit of the cure that might have saved his sister. The treatment protocol has stood the test of time for 15 years, a fixture in every textbook, yet no one thought to examine it closely. For the simple reason that no one deemed a 9-year-old's insights worthy of consideration, Dr. Whitmore remained unperturbed. Gazed at Sophia, whose breathing had grown steadier, her facial expressions reflecting a newfound tranquility since Marcus had started to converse with her, asserting, "So you're saying we've been slowly killing her for 2 weeks?" "Yes," Marcus replied, his tone unembellished. "But she remains a possibility for redemption. The real question lies in your willingness to acknowledge your mistakes." Dr. Whitmore felt the ground shift beneath him. For 3 decades, she had stood as the definitive voice of medical authority, the ultimate arbiter. Whispers of intricate diagnoses circulated, as the physician sought counsel from fellow practitioners when cases appeared bleak. Her reputation had been constructed upon precision, confidence, and an unyielding faith in the supremacy of institutional medical expertise. Now a homeless 12-year-old was implying that everything she had believed about this case was not merely incorrect but dangerously so. "This is impossible," she said, yet her voice betrayed a hint of uncertainty, requesting me to accept that a young individual, lacking any formal medical education, has pinpointed a condition that has eluded the notice of specialists from Harvard, Johns Hopkins, and the St. Marcus examined. She urged you to trust that, at times, experience holds greater weight than mere credentials. Dr. Whitmore sensed her conviction. Authority was slipping away like sand through her fingers. Around the room, she could see doubt creeping into the expressions from her meticulously curated team filled the air as Dr. Miller perused his own notes, a wave of uncertainty washing over him. Meanwhile, Dr. Kim was. With renewed focus, Dr. Dubois studied Sophia's face, quietly reviewing the medication protocols they had established. "I've been following Dr. Whitmore," and Dr. Kim spoke hesitantly. "Perhaps we should consider conducting further tests to explore any potential possibilities on what caused Dr. Whitmore to lose her professional composure, shattering the. What are you implying about the perspective of a street child who has gleaned knowledge of medicine from tattered textbooks? Do you grasp the weight of that suggestion? The culmination of our comprehensive diagnostic process, our extensive years of education, and our globally acknowledged expertise, all of it is insignificant in contrast to the insights of a homeless boy." Yet as she articulated her thoughts, Dr. Whitmore found his mind drifting back to memories, inconsistencies she had previously dismissed over the past 2 weeks regarding Sophia's EEG patterns that did not entirely conform to the conventional criteria for brain death, as her vital signs occasionally exhibited fluctuations without clear explanation. Due to the nursing staff's observations of subtle movements that the monitors had failed to detect, Marcus stepped closer to. Sophia lay in her bed, his voice steady even as the tension enveloped the room. "Sophia, I know. This situation is frightening, yet it's crucial for these doctors to recognize that you are still present. Could you attempt to move your right index finger?" With a mere flicker of his finger, Dr. Whitmore was on the verge of voicing his objection. In Sophia's condition, voluntary movement seemed an unattainable dream, yet she caught a glimpse of hope in the faintest twitch of her right index finger. "Finger, did you see that?" Maria Chen inhaled sharply, her finger directed at her daughter's hand. "Muscle spasm," Dr. Whitmore said quickly, her voice trembling. "Random neural firing. It doesn't indicate consciousness," Marcus continued, disregarding Dr. Whitmore's interjection. "Sophia," he pressed on, "could you please repeat that? Move your finger once more to demonstrate your understanding." The finger has moved again. This time, Dr. Miller stepped forward with a deliberate grace, his face as pale as the moonlight, casting a shadow over Elizabeth. "That isn't mere random neural firing, it's a responsive movement." Dr. Whitmore felt a surge of panic rising in her chest at the thought of Marcus being. Indeed, had Sophia remained aware during her treatment, every choice made by the medical team would have been not merely incorrect but possibly unlawful. The medications they had administered, the procedures they had carried out, the discussions they engaged in regarding the cessation of life support, everything had been undertaken to. A patient, fully aware and conscious, exclaimed with desperation, "This proves nothing." In vegetative states, individuals may display responsive movements, however, this does not signify the presence of higher brain function. Marcus opened. His textbook lay open to another marked page. "Dr. Whitmore, would you be willing to test her cognitive function?" What does it signify? Pose mathematical inquiries that demand contemplation rather than mere instinctive replies. Should she be able to respond accordingly? Blinking once for no, twice for yes, it will demonstrate that she is not merely conscious, but also cognitively intact, as Dr. Whitmore discovered. Herself ensnared, should she decline to assess Sophia's cognitive abilities, she would seem to be disregarding evidence that challenged her diagnosis if she concurred. To test, Sophia demonstrated an awareness that her entire career could be called into question, but if she agreed to test, and Sophia's silence could entirely undermine Marcus. "Fine," she said, her voice taut with tension, as she sought to reclaim her medical authority. "However, if this test fails to demonstrate cognitive function, I insist that this child be removed from my hospital without delay." Marcus nodded. "And if the test shows that Sophia is cognitively intact," Dr. Whitmore met his gaze, her jaw set with determination. "Then I'll implement whatever treatment protocol you suggest." The ICU descended into a silence so profound that the rhythmic sound of mechanical breathing, the sound of the ventilators echoed unnaturally as Dr. Whitmore made his way towards Sophia. Beside her, her hands quivered ever so slightly as she readied herself to perform a test that held the potential to either validate her medical expertise, to judge or to dismantle all that she had painstakingly constructed in her career. "Sophia, Dr. Whitmore." Her voice was formal and clinical. "If you can hear and understand me, I'm going to ask you some questions. Blink once for, not once, but twice for affirmation. Do you comprehend?" 2 distinct, intentional blinks. Maria Chen clutched her sister's hand with such intensity that her knuckles turned pale, as the medical professionals moved about the room, diligently attending to their tasks. Years devoted to the exploration of consciousness led them to encounter an experience that called into question every belief they had held.
Regarding Sophia's condition, Dr. Whitmore continued, her voice growing more intense. Are you more strained at 16 years old? 2 blinks. Are you in a hospital? 2 blinks. Dr. Whitmore's hands trembled, the responses lingering in the air, perhaps mere coincidences, reflexive and devoid of significance, yet the pattern was becoming impossible to ignore. Sophia, I'm going to pose a mathematical question. What is 7 plus 5 if the answer is 12? Blink twice if it isn't 12, blink once. The pause felt interminable. Forever, then, with clarity and intention, Sophia blinked twice. Dr. Kim released a small gasp escaped as Dr. Mayer stepped closer to the bed, his face a mask of disbelief. Dubois was hurriedly jotting down notes, capturing answers that seemed beyond the realm of possibility. Just one more question, Dr. Whitmore said, her voice barely above a whisper. Sophia, what month were you were born in June? Blink twice. If it was any other month, blink once. Marcus observed Dr. Whitmore's expression as she posed the question. The inquiry, acknowledging its strategic essence, revealed that she was evaluating not only Sophia's intellectual capabilities but also whether the responses seemed genuinely voluntary, or perhaps they were being subtly prompted. Sophia blinked. Once, Maria Chen whispered, she was born in September, her birthday is September 15th. Dr. Whitmore staggered backward, her face drained of color. The implications were staggering. Not only was Sophia conscious, but she was also cognitively intact, fully aware of her surroundings. The atmosphere around him was thick with whispered discussions regarding her condition, a reality he had been attuned to for the past 2 weeks as Marcus stepped. His voice, gentle yet firm, carried the weight of urgency as Dr. Whitmore addressed the situation. Sophia has been trapped inside her own body as your team deliberated the decision to terminate her life support. She absorbed every word spoken about the despair surrounding her situation. The rising costs of her care raised the question of whether it would be more compassionate to allow her to pass. The words struck Dr. Whitmore with the force of physical blows. Throughout her 30-year career, she had never confronted the unsettling notion that her clinical discussions might have been inflicting torment on a patient who was fully aware. In the face of a bleak prognosis, Sophia, Marcus pressed on, asking, can you find it in your heart to forgive these doctors? In the event of misunderstanding your condition, please blink twice for affirmation and once for negation. Within the confines of the room held its collective breath following all that Sophia had suffered during the 2 weeks of being treated as if she were unconscious object rather than a person. Her response would serve as the ultimate test of grace and humanity. Sophia blinked twice. Dr. Whitmore collapsed, tears streaming down her face as the full weight of her mistake settled in. Had constructed her professional journey on the belief that medical knowledge was inherently linked to costly education and an embodiment of institutional authority, yet a homeless child clutching a tattered textbook revealed a depth of diagnostic insight that was profoundly illuminating. Then her entire international team. What's the treatment? She whispered, her voice trembling. Marcus opened a textbook detailing a comprehensive treatment protocol he had meticulously compiled from various sources, focusing on anti-inflammatory medication, alleviate brainstem swelling through targeted neural stimulation exercises to restore communication pathways and, above all, the urgent cessation of the sedatives that have been dampening her neural activity is crucial. The transformation in room 314 was both immediate and profound, marking a significant moment of recovery. Minutes of Marcus detailing the treatment protocol that Dr. Whitmore had instructed the nursing staff to cease. The sedative medications that had been maintaining Sophia in a state of artificial neurological suppression, as the drugs did. As the remnants began to dissipate from her system, the transformations became evident on every monitor in the room. Her EEG patterns were, Dr. Kim announced with a voice brimming with wonder as she observed the previously flat brainwave activity. After 2 weeks, there are sudden indications of consciousness, theta waves are stabilizing, and we are observing alpha waves emerging. Patterns consistent with an aware yet relaxed consciousness. Marcus knelt beside Sophia's bed, his voice gentle yet urgent. Sophia, the medication that has been hindering your cognitive function is being discontinued. You may begin to notice changes in how you feel. Heightened awareness brings greater ability to navigate. Fear not if sensations begin to resurface. Dr. Whitmore observed in astonished silence as Marcus showcased the healing of the nervous system. Stimulation exercises he had discovered through his textbook research, employing straightforward techniques. Soft pressure applied to particular points along Sophia's arms and legs. Exercises crafted to awaken dormant neural pathways. Pathways and movements that inspired her mind to reconstruct connections that had been hindered by inflammation. Where did you learn these techniques? Dr. Miller inquired, his earlier skepticism giving way to a sincere professional curiosity. With a spark of curiosity, Marcus lifted his gaze from his work alongside Sophia, turning his attention to Dr. Elena Vasquez. The research encompassed comprehensive rehabilitation protocols, revealing that patients with locked-in syndrome can indeed experience recovery. Treatment is more effective when initiated without delay. However, many hospitals remain unaware of her techniques due to the limited exposure of her published work. Dr. Dubois inquired about the significance of smaller journals, questioning their role and impact. Treating homeless patients in free clinics, Marcus replied, the medical establishment simply didn't consider. Her research, pertinent to actual hospital populations, did not escape the irony felt by everyone present in the room. The study that Sophia's potential for salvation had been overlooked by conventional medicine, which concentrated solely on patients resembling Marcus, lacking insurance, devoid of social status, and absent the institutional support that propelled medical research. Credibility as Marcus persisted with the neural stimulation exercises, something remarkable began to unfold. Sophia's breathing, which had been mechanically regulated for 2 weeks, started to reveal signs of change. Her heart rate found a rhythm, aligning with the organic patterns of sleep rather than any medical intervention. Induced unconsciousness, Sophia Marcus said softly, I want you to give this a go, attempt to wiggle your toes. Don't fret if it doesn't come off flawlessly, your mind is simply recalling the motion. Maria Chin observed her daughter's feet with a fervent intensity, her gaze filled with a sense of urgency that lingered for several moments. Nothing occurred, and then, gradually, almost unnoticed, Sophia's right big toe. Oh my God, Maria whispered, her hands covering her mouth. She moved her toe. She actually moved her toe. Dr. Whitmore experienced a sensation she hadn't felt since her formative days as a medical student, the sheer wonder of observing a healing that appeared miraculous, yet was truly the outcome of accurate diagnosis and effective treatment For weeks, she had been administering medication that stifled the very neural activity Sophia required for her recovery. Marcus swiftly pinpointed the issue and offered a solution just 15 minutes after assessing her, the anti-inflammatory medication ought to be administered intravenously. Marcus continued to consult his notes on prednisolone at a dosage of 30 mg per kilogram of body weight, succeeded by a maintenance dose over the course of 7 days, addresses the inflammation of the brainstem. Should start to diminish within 6 to 8 hours. Dr. Whitmore found herself following medical directives from a 12-year-old, a homeless boy, and for the first time in her career, it felt entirely fitting. Marcus grasped Sophia's condition surpassed that of anyone else present, for he had endured the repercussions of medical ignorance throughout his life. The loss of his sister had imparted a depth of understanding that no institution could ever teach. Marcus, Dr. Whitmore said. Softly, he inquired, what brought you to this hospital tonight? Marcus raised his gaze from Sophia, his youthful features etched with seriousness. For 3 years, I have been scouring hospitals across the city, searching for cases akin to Lily's, when I stumbled upon Sophia's story on the news. A teenage girl lies in an unexplained coma, and I felt an undeniable urge to take action. I knew I had to try. After all, you've been navigating this journey. For 3 years, each night, Marcus diligently sought out the patients that the doctors had abandoned cases where the symptoms aligned with what I had studied regarding Lily's condition. Dr. Whitmore came to understand that there I was, observing an extraordinary scene. A 12-year-old boy, remarkably, had taken it upon himself to run his own medical practice right on the streets of Chicago, harnessing the insights drawn from sorrow and resolve to rescue lives that the formal medical establishment had overlooked. Dismissed by many, he found success in areas where they had faltered, and news of Sophia's progress circulated throughout Metropolitan. The hospital buzzed like wildfire. Within hours, medical staff from various departments started crafting excuses to stroll past the room. 314 yearning to catch sight of the homeless boy who had achieved what a $1 million medical team could not. Dr. James Morrison, the hospital's chief of staff, arrived at 3 a.m. to witness the situation firsthand. He found Dr. Whitmore sat beside Sophia's bed, attentively observing the neural stimulation exercises that Marcus had devised. She instructed her on how to perform, and Dr. Morrison spoke softly, asking, "Is it true? A homeless child, truly diagnosed with locked-in syndrome, while your entire team overlooked it?" Dr. Whitmore glanced up, her expression revealing the weight of the moment. The weariness and humility of an individual whose core convictions have been irrevocably broken, not merely identified, is evident in Jim. As the treatment progressed, the monitors displayed a positive trend. Sophia's brain activity showed notable improvement in the theta wave.
Patterns that had been chaotic for 2 weeks were beginning to stabilize into coherent rhythms. Her muscle responses were. Her coordination was improving, and most notably, she had started to display REM sleep patterns for the first time since her hospitalization raised the question, where is the boy now? Dr. Morrison inquired. In the family lounge, Dr. Whitmore replied. He had been awake for 20 hours straight, monitoring Sophia's progress and adjusting following the treatment protocol. Informed by her responses, Dr. Morrison discovered Marcus nestled in the small family lounge, curled up in a chair cradling his torn medical textbook, its pages splayed open across his lap, the boy's slumbering form nestled within the stillness. His hand lay protectively on the book that had become his most cherished possession. "Excuse me," Dr. Morrison said. Softly, without the intention of startling him, Marcus awoke instantly, his eyes wide and alert despite the circumstances. His exhaustion is palpable. Is Sophia all right? Do the monitors indicate ongoing improvement? Dr. Morrison was taken aback by the boy's swift concern for his patient, a remarkable display of medical dedication that even among seasoned physicians, such cases are seldom observed. She is progressing well, with her neural responses steadily improving. Good, Marcus said, relief evident in his voice. The anti-inflammatory medication should reach peak effectiveness within. In the coming hours, her ability to communicate was expected to enhance considerably. By morning, Dr. Morrison took a seat opposite Marcus, observing this extraordinary child who had defied all expectations at Metropolitan Hospital. Regarding medical expertise, Marcus, I have a question for you. How many other instances similar to this have you come across? Marcus paused in silence for a moment before he opened his textbook to a section near the back revealed pages adorned with handwritten notes, meticulously documenting dozens of cases, complete with names and dates. 17 patients have presented with symptoms over the past 3 years, leading to various outcomes in hospitals, Marcus stated succinctly. There were 12 recoveries, 3 partial recoveries, and 2 instances where I arrived too late. Dr. Morrison felt his breath catch. You're telling me that you've been successfully treating patients all across the city? Unbeknownst to anyone, I found myself in a position where I had to address Marcus's situation, correcting and diagnosing him in silence, identify the appropriate condition. I endeavor to convey the information to the medical teams. At times they heed my words, while at other moments they do not. When they fail to listen, Marcus's expression darkens with sorrow. Lives are lost from conditions that could be managed, as physicians may be reluctant to entertain the possibility that their diagnosis could be flawed. Morrison came to understand that he was confronting a medical phenomenon unlike any he had encountered in 3 decades of hospital experience. The administration revealed that this homeless child had been running a clandestine medical practice, pinpointing diagnostic errors with remarkable acuity, and rectifying them whenever feasible, all while navigating life on the streets and subsisting on the kindness of others. Marcus, what would, if I were to share with you that this hospital is eager to extend a formal offer for the position of medical consultant, granting you full access to? Marcus appeared taken aback. You want to hire me? I wish to learn from you, Dr. Morrison expressed sincerely. You have shown diagnostic skills that surpass those of our most costly experts. Specialists lack an understanding of medicine in ways that medical school doesn't teach. Marcus contemplated this for a moment. He paused for a moment, then shook his head. I appreciate the offer, but there are too many patients in other hospitals who need help. Assistance is urgently needed. I find it impossible to remain stationary while lives are lost due to preventable errors. Dr. Morrison confronted a level of medical dedication that rendered his entire professional staff inadequate. A young boy of 12 transformed his own sorrow into a quest to rescue others, and he was resolute in his commitment to that mission, refusing to trade it for comfort or security. Then what would you propose regarding a partnership? Dr. Morrison inquired. Metropolitan Hospital could sponsor your work citywide, give you resources, credentials, support. For the first time since Dr. Morrison had met him, Marcus smiled. Now that, he said, it seemed like a scenario straight out of Lily's imagination, as the confrontation that had been simmering for hours finally erupted. At 6 a.m., when Dr. Whitmore could no longer suppress the weight of her professional shame and the stirrings of personal revelation, she sought out Marcus. In the hospital cafeteria, he sat solitary at a corner table, cradling a cup of coffee that a kind-hearted nurse had delivered to him, and his omnipresent medical textbook. I need to talk to you, Dr. Whitmore. She slid into the seat across from him, her usually perfect appearance now disheveled, her designer clothing slightly askew, wrinkled from the long night, her carefully styled hair cascading loosely around her face.
Marcus looked up from
his textbook, his young eyes locking onto hers with a frankness that stirred a mix of discomfort and urgency within her.
"I've been
reflecting on your words," Dr. Whitmore continued, her voice taut with emotion, regarding credentials versus I seek to grasp the distinction between pride and patient care, and I find myself pondering how a 12-year-old might comprehend this concept. A homeless boy possessed a deeper understanding of medicine than the doctors who had dedicated decades to their studies.
Marcus fell silent for a moment.
Reflecting on his response, perhaps it stems from my pursuit of medicine, driven by the desire to save lives rather than for personal gain. The notion of choosing between wealth and the cultivation of one's reputation struck Dr. Whitmore with the force of a tangible impact, for she came to acknowledge the reality within them when her medical practice shifted focus, becoming more about preserving her status than. When did she cease to view her patients as individuals and begin to regard them merely as cases to be resolved? You're suggesting that I chose the path of medicine for misguided motives, but perhaps you've overlooked the true purpose behind it.
Reasons, Marcus responded softly as I perused each page of the medical textbooks.
Brings to mind Lily, each symptom description evokes thoughts of patients who may be enduring similar struggles.
Conditions that often elude doctors when one delves into medical literature. What are your thoughts on the insights that Dr. Whitmore uncovered?
With piercing clarity, she contemplated the prestige of publications and the nuances of professional advancement, reflecting on the complexities intertwined within. Opportunities that would elevate her standing and profitable engagements that would boost her fortune. She couldn't recall the most recent occasion when she delved into medical research, driven by the desire to gain insight into a patient's condition. My sister suffered and ultimately passed away because doctors like you failed to consider that a 9-year-old might be aware of something amiss. Important, Marcus continued, his voice steady yet laden with profound sorrow. My observations were dismissed due to a lack of credentials, and evidence was overlooked simply because it originated from an individual. You deem me unqualified to express my views on medicine, mirroring the very treatment I once faced. To you, Dr. Whitmore said quietly, assessing my knowledge through my credentials rather than my results. Marcus. He shook his head. No, Dr. Whitmore. I am assessing your knowledge based on your results over the past 2 weeks, as well as your credentials, guided you to gradually end the life of a conscious patient, while my absence of credentials allowed me to rescue her in a single night. The declaration, suspended between them like an abyss that defied any attempt at bridging with words or rationalizations. Dr. Whitmore had dedicated 3 decades to constructing a career rooted in the belief that medical education was the sole avenue to medical knowledge, that institutional authority equated to accuracy, that costly specialists were fundamentally more adept than those with fewer credentials. Marcus had validated all of those beliefs.
Catastrophically wrong. What do you want from me? Dr. Whitmore asked finally. I want,
remember why you chose the path of a doctor, Marcus replied.
I want you to see the patients, not just the tests. I urge you to pay attention to families, even if they lack medical expertise, and to take their perspectives into account. At times, the most profound medical revelations arise from those who truly grasp the essence of suffering, rather than solely from those who possess formal knowledge. Grasped the intricacies of the systems, Dr. Whitmore felt tears welling in her eyes as she came to understand that this homeless child was presenting her with a gift she hadn't encountered in decades, the chance. She whispered, yearning to recall the essence of being a healer, transcending the mere role of a medical technician. How do I do that? How do I?
Transforming all that I once held true about medicine. Marcus extended his hand across the table, softly brushing against hers.
You begin by
acknowledging that qualifications alone do not define a superior physician. Rather, it is the compassion and dedication that truly matter, and you demonstrate this by leveraging your role to offer hope to patients whom others had deemed hopeless. Dr. Whitmore gazed into the eyes of this extraordinary child, and she witnessed not only a depth of understanding that surpassed his age but also a journey toward atonement that she had never thought conceivable.
Will you guide me? Me, she asked.
Marcus smiled for the second time since they'd met. I'll learn with you. At 7:30 a.m. exactly, 18 hours after Marcus had first burst through the ICU doors, Sophia Chin opened her eyes, a moment witnessed by her parents who had kept their watch throughout the night, while Marcus diligently observed her neural responses every 15 minutes. Minutes passed, and Dr. Whitmore, who had been documenting the unprecedented recovery with meticulous detail, observed Sophia Maria Chen,
her voice barely a whisper in the stillness of the room. Baby, can you see me?
Sophia's eyes drifted gradually, following the sound of her mother's voice until their gazes finally intertwined. The effort was palpable, yet, with unwavering resolve, she whispered her first word in 2 weeks, Mom. the sound of her voice. Maria Chen was utterly shattered by her daughter's voice, a sound that pierced through the 2 weeks of silent bedside vigils and medical consultations, provided no solace in readying herself for the heart-wrenching prospect of losing her child. Of it melted away in the enchantment of that one phrase, "I'm here, sweetheart, Maria," she sobbed, taking Sophia's hand and feeling the gentle pressure of her daughter's responding squeeze. "I'm right here," she whispered. Marcus stepped closer to the bed, his medical textbook clutched against his chest. "Sophia, do you remember me?" Marcus, I've been assisting your doctors in grasping your condition." Sophia's gaze met Marcus's, and a smile graced her lips. Into the faintest smile, "You saved me," she whispered, her voice softening ever so slightly. "No," Marcus said gently, "I just helped everyone understand that you were still in there." Struggled to regain her footing. Dr. Whitmore observed this interaction with a tumult of feelings she couldn't entirely comprehend. For 2 weeks, Sophia had been regarded as a medical case, a complex diagnostic puzzle to be unraveled through costly tests and evaluations. In the realm of international consultations, Marcus regarded her not merely as a subject, but as a person, one ensnared in fear, yearning for understanding and a voice to be acknowledged. "Understood, Sophia," Dr. Whitmore said, stepping forward. "I owe you an apology. My team and I misinterpreted your condition, and our treatment inadvertently exacerbated your situation rather than improving it. I am truly sorry." Sophia gazed at Dr. Whitmore, her eyes devoid of anger, filled instead with a profound sense of relief. "I heard every whisper she shared, all those conversations about surrendering. I longed to convey that I remained present, the entirety of it." The weight of the medical team's mistake became devastatingly clear. Sophia had remained conscious throughout her entire ordeal. Hospitalization, absorbing the clinical discussions surrounding her bleak prognosis, listening to discussions regarding the financial viability of her treatment while being involved in dialogues surrounding the final stages of life. Decisions she had felt confined within her own body as medical professionals dictated the course of her future without. Recognizing her awareness of the decisions at hand, Marcus inquired, "How do you feel now?" His voice carried a weight of curiosity. With the weight of professional concern, Sophia admitted her fatigue, her clarity emerging like fog. "It is as if a weight is being lifted from my mind. My body feels heavy, yet I am acutely aware of everything now. Before, it felt as though I were submerged beneath the surface, sounds echoing around me while I remained unable to respond." Marcus nodded, deep in thought as he consulted his notes. "That's precisely the sensation of locked-in syndrome. Your mind operates as it should, yet the inflammation within disrupts everything." Dr. Whitmore realized that the brainstem was obstructing the signals from effectively reaching the muscles. She was experiencing something unparalleled in her medical career, a patient capable of articulating the subjective experience. In a realm where many physicians grasped only the clinical aspects, Sophia's profound insights held the potential to transform the understanding of locked-in syndrome. Sophia was diagnosed with the syndrome and treated. Dr. Whitmore said carefully, "Would you be willing to help us? Gaining insight into your experiences and emotions over the past 2 weeks could provide valuable support to other patients facing similar circumstances." Sophia glanced at Marcus, who offered an encouraging nod. "If it helps others avoid what I experienced," she declared, "I want to help." Marcus smiled, seeing in Sophia the same unwavering resolve to alleviate suffering that he had taken the reins of his own medical education, and I believe he remarked softly, "That's precisely it." For the first time since her recovery began, Sophia posed the question that would reveal what Lily might have desired as well. Transform everything. Who is Lily, and what of Marcus? They began to weave the tale that had united them all, the tale of a sister whose passing had imparted to her brother the lesson that often the most vital medical insights are gleaned not from textbooks but from the moment Sophia awoke. Metropolitan Hospital transformed into the epicenter of a medical tempest that would transform the institution's perception of diagnostic expertise as Dr. James Morrison navigated a flurry of incoming calls. Medical journals, news outlets, and hospital administrators from across the nation are all seeking to comprehend how a homeless child had triumphed where esteemed specialists from around the globe had faltered. As reported by Morrison, the journalist from the Chicago Tribune, in the midst of his third interview of the morning, posed the question, "What does this reveal about the current state of modern medicine? When a 12-year-old, lacking any formal training, can surpass the dosage knowledge of Harvard-educated physicians?" The question pierced through the essence of what Dr. Morrison anticipated would evolve into a nationwide dialogue concerning medical authority within institutions.